Today's topic is irritable bowel syndrome, that is IBS. Irritable bowel syndrome is characterized by recurrent abdominal pain associated with abnormal defecation in the absence of a structural abnormality of the gut. About 10 to 15% of population are affected by IBS. There is a criteria, Rome criteria, which consists of recurrent abdominal pain or discomfort at least 3 days per month in the last 3 months, associated with 2 or more of the followings. These are improvement with defecations, onset associated with a change in the frequency of stool, and onset associated with a change in the form of stool. There are lots of causes of IBS. The main causes are biopsychosocial cause, and some are dietary and some are due to alteration of gut bacteria. So, in case of a IBS patient, the patient will present to us a young male or female with abdominal pain relieved by defecation. It could be constipation or could be diarrhea associated, or sometimes it is only abdominal bloating, that is dyspepsia. We will do some investigation to the patients. The complete blood count will be normal. Fecal calprotectin will be normal. The fecal calprotectin will increase in inflammatory bowel disease. We will do thyroid function test because hyperthyroidism is associated with diarrhea. And also we will do other tests such as colonoscopy. The colonoscopy will be normal in these cases. So our differential diagnosis of irritable bowel syndrome are inflammatory bowel disease, hyperthyroidism, malabsorption syndrome. So in case of this investigation, we will find no positive findings. There are some supportive diagnosis features and some alarming features of IBS. The supporting diagnostic features are presence of symptom persists more than 6 months and frequent consultation with gastroenterologist and previous unexplained medical illness and symptom worsened by stress. Some alarming features are age more than 50 years and male gender, anemia, weight loss, family history of colon cancer and rectal bleeding. So after all the investigation, when the IBS is confirmed, then we will do the management. The first management is reassurance of the patients. But if the symptom persists and if it is diarrhea predominant, then we will avoid some food for the patients such as legumes, excess dietary fibers. And then we will add some antidiarrheal agents such as loperamide or cholestyramine. If symptom persists, we will prescribe amitriptyline or imipramine and some rifaximin, that is antibiotic, for 2 weeks. If patient is constipation predominant, we will give the patient a rough diet, fiber associated diet, ispagul husk or psyllium or lactulose. If symptom persists, then we will prescribe procalopride. It is a type of prokinetic agent. It will increase our peristalsis activity. And if symptom persists, we will give duloxetine, relaxation therapy, biofeedback or some hypnotherapy. These are psychological therapy. If patient has pain and persistent bloating, we will modify the diet and exclude wheat and dairy and gluten-free diet. And if symptom persists, we will prescribe the patient mebevarin or peppermint oil or hyoscine. Sometimes we prescribe probiotics. Also sometimes the rifaximin, the antibiotics. And if symptom persists, we will prescribe amitriptyline or imipramine at night. That's how we will manage the IBS patients.